Yeah, in this episode, we would like to discuss about why your malaria keeps coming back. There could be so many reasons for you having a recurrent or a repeated malaria infection. The first one is improper treatment. If you have malaria and your malaria is not well treated or optimally treated, you can easily have a resurface of the malaria. We call it when the treatment is suboptimal. Maybe you think you have malaria when you're supposed to get a parenteral medication like injections, but you take tablets and it's not really catching the malaria. You currently have a malaria. Another thing is when you use a wrong medication. If you use a fake drug for treating your malaria, definitely you or the drugs that is not as potent as expected, you might have a recurrent malaria. Another reason for a recurrent or why your malaria keeps keeping coming back is a wrong diagnosis. You might not actually have malaria and you use anti-malaria, whereas you have some other inflammatory reaction that is going on within you. You still keep having all those symptoms of malaria. Even all those symptoms of malaria can come in early signs of pregnancy, can come with a patient that has a long time diabetes mellitus. That is somebody that has high blood sugar, and you think you might not know you have such, and you are using anti-malaria, then you still keep having the symptoms. Another reason for you having a recurrent malaria is reinfection by a female Anopheles mosquito. You might actually have malaria, get it well treated with normal dose, normal and everything, and you feel well. But if you get reinfected with a female Anopheles mosquito bite, especially if you are the type that lives in a swampy environment, or your gutter is not well clean, you don't have a good drainage stuff, and maybe you're not using a mosquito net, you can actually get reinfected by. You never can tell. It's always better if you think you have a suspected case of malaria, go to the hospital, let them do a microscopy to test, to check the quantity of malaria parasites you have, how severe it is, and that will determine the route or the type of medication you are going to be given, if it's going to be oral drugs or parenteral or injection. If you self-medicate a lot and you are liable to have a recurrent or repeated malaria infection, it's always better when you feel symptoms of malaria, go to the hospital, let a lab test be done, confirm the severity of the malaria, let your healthcare provider manage the malaria for you instead of getting all these over the counter drugs. See you in the next episode. God bless.